I am John Coen. I am a native of Nashville, Tennessee, and I am an adult reconstructive surgeon, mostly for hip and knee replacements. I think I chose the medical field from inspiration I'd had dating back to middle school. I had a science teacher who was 6'4" and a small college basketball player, and managed to take science class from him for 4 years. And I think that started the interest in science. At the end of my time with him, I broke my forearm playing mid-school football, and that was probably my first taste of orthopedics, and I think somehow that may have started me down that road. My dad's an engineer. I think part of it's genetic. I chose orthopedics a little later in the game than I would initially have thought. As a guy who grew up with 5 sisters, when I went to medical school, I was thinking seriously about whether or not obstetrics and gynecology were it. But I discovered when I did my orthopedics rotation that I could do that from 6 in the morning till after 7 at night, and really looked at my watch. And if that could occupy my thoughts all day, I thought that should be something I should pursue. The best part of being the orthopedist is seeing the tangible results. You know, you have patients who come in frequently with crippling arthritis. You get a chance to literally change their life. I think nothing more visible than in the operating room. I mean, you come in, you look, you see, by the time you finish the procedure, you can clearly see a difference. A few weeks later, when you see them in the office, you get to appreciate the difference that makes. Because most patients will tell you it made a massive difference for them. Yeah, if I had not gone into medicine, I probably would have chosen a teaching or coaching, being able to impart knowledge. In many ways, we teach our patients, and I think teaching students would be probably the next thing I would be inclined to do. Yeah, so when I'm not doing this job, I get occupied by the life I get to lead with my wife and the 5 kids that we were blessed to have. The empty nest life has been with us for the last few years because our youngest actually just graduated from college and officially moved out to move on. They're scattered now. They're 32 to 22 and live in 4 different major cities. Where we used to have to go to ball games and schools, now we get to travel and see nice places and see what they have become. So my wife's a physical therapist by trade, so when we get the opportunities to see the sights in and around Portland, take those in and do those things. And if I can get her out of the yoga studio. She has not gotten me to the yoga studio just yet. So we'll see if that ever transpires. I think they'd have to resuscitate her after I got to the yoga studio.